Hello, everyone. This video podcast marks the start of a new initiative to Psychiatry where I'll be interviewing teen mental health specialists to gain a better understanding of the therapy and intervention side of teen mental health issues. Today, I'm joined by Dr. Samuel Okechukwu, a psychiatric nurse practitioner at the My Psych Provider Mental Health Clinic in Rockaway, New Jersey. With over a decade of experience in various healthcare roles dedicated to patient care, Dr. Okechukwu is committed to delivering top-tier, comprehensive mental health care that reflects his passion for improving the lives of those he serves. So thank you so much, Dr. Okechukwu, for coming and being on this podcast with me. So before we start, I just wanted to ask, could you give a quick introduction of yourself and why specifically you decided to pursue a career in psychiatric nursing?
Okay, so my name is Samuel Okechukwu. I'm a psychiatric nurse practitioner. So initially, I got into the healthcare field as a licensed practical nurse. I followed through and I got my bachelor's degree in public health. Then I moved forward and got my master's degree in nursing as a clinical nursing leader. I had to go to Chicago to do that and kind of like went to move forward and got my psychiatric nurse practitioner. I got into this field because my mom was a nurse and I became interested in some of the stories she kind of like told in the psychiatric, field, and that kind of like interested me. So I was like, you know what, let me try this. And that was, I got interested in. I'm like, that's actually what I was interested in doing. So, and it's been awesome. It's been great. Um, it's just fulfilling seeing people at their lowest and seeing them thrive. That's kind of like the most fulfilling thing with this field. So I would not trade it for anything. So yeah.
Yeah, I completely agree. That's why I've been so motivated to try and help other people on social media. So it's great that our interests align. So my second question is, could you kind of describe a typical day in your role as a psychiatric nurse practitioner? So what do you see every single day?
So a typical day, I mean, it varies. Every day is different.
Yeah.
So I do also work in an outpatient clinic where we do provide TMS. It's called transcranial magnetic stimulation. So we treat depression with a device called TMS. And what that does is it stimulates the part of the brain called the left dorsolateral prefrontal cortex. And that treatment span goes for about 36 in total. And around, I would say halfway through, we tend to start assessing how is patient feeling. And once they start getting better, we just keep them on the same protocol. And a lot of times they get better. Sometimes when I work in my private clinic, I would say mostly medication management and psychotherapy. And I mean, typical days, sometimes we have new patients, come for evaluations, we diagnose them and study more medications, or we just have follow-ups to kind of like check in how is the patient doing? Are they getting any better? Do you have to make any adjustments, things of that nature. So every day is a little different. Yeah.
Okay, yeah, that makes sense. All right, that's really cool. And I think you already explained this, but just to quickly recap, like what kind of training and education did you have to go through to get to this area?
Okay, so I would say my path was I got a licensed practical nurse is not a degree. That's initially I got it when I got out of high school when I was about 18, 19.
Hmm.
After that, I moved forward. I got my bachelor's in public health. After that, I went to Chicago Rush University and I got my master's degree in nursing as a clinical nursing leader. After that, a year experience, 2 years experience, and I enrolled in Maryville University in St. Louis, Missouri, and got my psychiatric nurse practitioner degree.
Hmm. And just a follow-up, why did you choose a psychiatric nurse practitioner over any other like mental health specialty?
I wanted something that was directly caring for the patients.
Hmm.
I've done bedside nursing, that was one aspect of it, but I wanted something that you actually engage with these patients, you provide the care, and you see the results. That's one thing
Hmm.
that's what drives me every day,
Yeah.
just seeing people that are lowest. I know I've said this before, but just seeing someone not able to do anything, not able to go out, being anxious all day and seeing them going around doing everything they have to do. I would say that's the most fulfilling part of the job. Yeah.
Yeah, for sure. I totally understand that. Yeah. That's so cool. And you answered my next question. I was going to ask what's the most rewarding part. But if you
Yes.
could tell me, what is the most challenging part of your job?
The most challenging part is, that's a good question. It can be difficult when, and I mean, this happens once in a while when you can't really find, you've tried everything, nothing has worked, or you get a patient that has seen so many providers and nothing has worked. So it's kind of like sometimes it's hard to instill that hope in the patient that, what, there's still hope, there's still hope, and we could try so many other ways to kind of like get things rolling. So sometimes it's just instilling that hope and allowing them to just have that little more patience that let's try something else. So I would say that's the most uh I would say that's the most difficult part of it. Yeah.
Yeah,
But
I get that. Yeah.
yeah.
I mean, I've done shadowing of doctors and I see like patients, sometimes they can be very impatient and like but like at the end of the day, we can still get them to where they want to be. So I think that's important for them to realize. Yeah, for sure. Yeah, I completely get that. Okay, so now let's shift a little towards patient care. We just talked about your job and let's shift towards patient care. So can you explain the process of like diagnosing a patient with a mental health condition?
So initially, I would say the first part of when you meet a patient, you got to build trust. Trust is not something that you get in one day, but you got to build a rapport, build trust, and you comprehensive assessment, you have to get a history of when everything started, you know, when everything started and create a timeline leading up to what's present. And also get family history. A lot of times, a lot of symptoms, if you hear some of the symptoms, it rings a bell because I would say, for example, bipolar disorder is very genetic, you
Mm.
know? It's very genetic. So a lot of times when the father or the mother has bipolar and the patient shows up with depression, you want to screen for bipolar because it's a high chance that that's something that's also there, just to, give the patient the best treatment, that they could have. Because I would say one thing with bipolar is if you start treating bipolar with just a depression medication, you could worsen the patient and send the patient to become manic. So you want to
Oh.
just kind of rule that out to make sure there's no bipolar, and okay, let's move into treat for the depression that you came in with.
Mm. Have you ever had an instance where you've like seen like a false diagnosis or misdiagnosis?
Happens all the time. Happens all, and you know what? It happens all the time, man. I wouldn't necessarily blame the provider that kind of like diagnose because at the end of the day, it's all diagnosis based on what are you presenting with, and
Yeah.
also information that you're getting from the patient. Sometimes they're not forthcoming with all the information that you're not gonna know.
Mhm.
So, but what I've seen is that along the line, they tend to open up more, especially I would say, for example, the med provider couldn't really open up fully and just gave, I would say, not full information. They're just going to go by what was given to them to make their diagnosis. So it's always good to, that's why I always tell patients, it's always good to be forthcoming and just tell us everything that's going on so we can help you the best way possible.
Yeah, that makes sense. Okay. That's cool. Um, the next thing is what kind of therapies and treatments do you most often use with your patients? I know you just explained one, but just more.
Okay. Yeah, so one of them was the transcranial magnetic stimulation. We use that to treat, it's FDA approved for depression and OCD, but we also use that off label for anxiety. Medication wise, we treat everything like bipolar disorder, depression, general anxiety, OCD, panic attacks, schizophrenia. I would say pretty much every mental health diagnosis, not personality disorders. I would say that's more therapy. But I would say majority, yeah, those are kind of like the most. I would say the diagnosis we treat. Yeah.
Okay. Nice. And how do you determine what's the best treatment? It's just based on whatever issues that they're facing, or is it like different even if like two people, let's say, had depression?
So many factors play into that. So many factors play into that. First of all, the history. Um, what has their, I'll say, I'll give an example. Um, let's say a patient comes in and they complain of a history of abuse, right? If
Mhm.
a patient comes in and they complain of a history of abuse, how do you treat that? You got to be very careful with that because it can bring back traumatic experiences. So you have to just gotta have to be very careful in navigating how you assist them just to avoid triggering, some symptoms that just makes them shut down. I don't know if I answered the question. If you could repeat the question again.
Yeah, no, I was just asking, how do you determine the best treatment plan? But that does make sense. Like,
Yeah.
yeah.
Yeah, the best treatment plan possible is, I mean, we already have medications that are um, FDA approved. But if a patient also comes in, because like I said, initially, when you get the initial comprehensive assessment, if a patient has a history of, let's say, for example, like a metabolic disorder, like a diabetes,
Mhm.
and they come in with, and you have to add in like an antipsychotic medication, you want to be very careful because, some of these medications can worsen some of those underlying diagnosis that they already have. So you just got to be careful to walk around that to avoid worsening because the goal is to kind of like get the patient back on track. So many things play into it. Yeah, but
Yeah, yeah. Okay. That makes sense. Okay. That's cool. And then yeah, you answered the next. Okay, so now we're gonna shift towards like teens because that's where my advocacy mainly comes in with teenagers. And I did see that on your site it said that you treat patients that are 12 and up. So I just wanted to ask, like, how often do you see patients of that age range? Is that often or not really?
not so often. I would say majority of the patients are 18 and up, but I would say sometimes I see patients between, 12, 13, 14, 15, you know, from time to time. Yeah.
And what issues do they usually face?
I would say generally it's mostly anxiety, depression, ADHD, um, or outbursts, just anger outbursts. So, but a lot of time that's can be age as well. So,
Yeah, that makes sense. And then I know how you said like the first part of treating with any patient is to build that trust, build that rapport. But how do you do that for teens as opposed to adults?
so same way you have
Oh,
to. So there's one thing that you can fake, empathy. You have to
yeah,
have empathy, especially when it comes to psychiatry. You have to care because if you don't care, you're not going to provide the best care. So
exactly. Yeah.
and empathy is something that you can, if I have you as a patient and you see the empathy, it's not something that someone has to tell you. You're gonna feel it. So empathy is the first, step I would say in and just showing the empathy and just caring. Once you care for the patient, you would treat them how you want to treat yourself if you were in that same position. You know,
Yeah. Yeah,
yeah.
that makes sense. Yeah. And then since teens like they're dependent on their parents, of course, how do you bring involve parents and guardians in the process of treating these teenagers?
So both parents have to be involved.
Mhm.
Sometimes you would, treat a patient where maybe the parents are divorced, but both parents just have to be involved. Maybe they have to join the Zoom meeting, the dad and the mom, the patient, but as long as the patient is below 18, parents have to be present. Yeah.
And okay, yeah. And like, do you is like whatever you speak with the patient, is that confidential to the patient, or do you also tell that to the parents?
It's confidential unless the be- the patient becomes a danger to themselves or others. There is
Okay.
something that has to be reported, so
Yeah.
it's confidential unless. But then again, also, um, yeah, I would say it's confidential unless the patient is at risk to themselves or
Yeah,
others.
that's reasonable. Okay. And then do you so this can be related to teens or with any of your patients, but I want to know like do you care to share some like success stories or like particularly rewarding experiences for you when working with patients?
So it's a lot of that. So I've seen patients that couldn't leave the house due to anxiety, couldn't drive, couldn't do anything, absolutely nothing, stuck home. crying, just being anxious about everything. And in 4 weeks, 4 to 8 weeks, patients out and about driving, doing everything they have to do, going to work, going out with friends. I had someone did mention I got on the elevator for the first time in 15 years, you
Wow.
know, due to anxiety. So it's so many something sim stories like that are very similar. So yeah.
Oh, so how do you do that? I'm actually just curious. How are you able to do that so quickly?
So everyone responds different to medications. Some people
Yeah.
respond fast, some people respond very slow. Sometimes you have to, try other medications. You have to try something if it's not working, but you also have to be, I would say, frequently monitoring in the beginning to know if something is just not working. You don't want to just keep them on the same thing for a long time. You want to change it as fast as possible. Yeah.
Hmm. Yeah. Okay.
So yeah.
That's interesting. Okay, so I guess we can shift now to like mental health advocacy. So, I mean, you obviously, I can tell, care about mental health, all of those issues. So, what have you done, maybe just like personally throughout the years of your career to kind of help with mental health for society as a whole, other than just your practice, if anything? It doesn't, you don't have to say anything, but
Right.
sometimes like I'll see that doctors will go to conventions and things like that. I was just curious
Yeah,
if
I go to frequent conventions, there are a lot of psychiatric conventions to you learn more networking
Mhm.
and to see other aspects of treatment. Sometimes there can be new treatment modalities that are, researched and the work. And so yeah, so I say frequent networking and just going for seminars. Yeah.
Hmm. And how have you seen like the way in which you approach patients or like handle patient care? Have you seen it like evolve over the years of your practicing?
So that's a good question. That's a good question.
If you can't think of it right now, we
One
can.
thing I would say is, as a new provider, experience teaches you more, you know?
Yeah, of course.
Experience teaches you more, and the more you get experience, that also tailors your approach.
Hmm.
So I would leave it at that.
Yeah, that makes sense. That's gonna be interesting for me in the future. Yeah, hopefully I learn things along the way and can change it. So that's awesome. I was also gonna ask, how do you think that someone like what advice would you give to someone in society, anyone who wants to kind of advocate for mental health? Like, what do you think is important for them to understand?
Someone that wants to advocate for mental health.
Yeah, like just like the perspective that you have on mental health, what do you think is a very important aspect that other people need to understand in order to make a difference for everyone struggling with mental health?
I would say one thing is that um, not everybody shows you what they're going through.
Hmm.
And the fact that someone is smiling doesn't necessarily mean they're happy. It's always good to care, ask questions, um, ask questions genuinely, and ask questions with the mind of, I want to help you, you know? Just, I think those are the main, I think those are the basis. Those are the basis to these things. Yeah.
Yeah. What are some goals that you have for your own personal career that you want to see as you,
I think my goals are to help more people.
yeah,
It's my
makes
help
sense.
more people and see more people being able to just navigate through life independently and with support. Yeah.
Yeah. Okay. Oh yeah, and also just going back to your career, so did you decide like very early on that you wanted to go into like mental health and things
No,
like that?
no.
Okay, so you want to
Initially,
share like
I
yeah.
was going to do engineering.
Oh, okay.
Then I kind of like I wanted to do, when you're younger, you're not really sure. Then again, I
Hmm.
think I wanted to do physical therapy, but that wasn't it
Hmm.
until when I became a licensed practical nurse. I'm like, okay, that's actually the path that I wanted to go with.
Hmm.
And that was
Hmm.
after high
And
school. My mom was like, you know what? how about you go do 1 year program for the licensed practical nurse and see if you like it? And that was kind of like it. Yeah.
Yeah, okay. That's good because I don't know. For me, like I think for me and people my age, like we're not 100% sure sometimes of what we want to do, but it's inspiring to see like someone turn out successful even though like they didn't know it from the start. So that's good. That's reassuring for me.
Absolutely.
So what do you think that communities, it could be work communities, school communities, any communities, can do to better support those with mental health issues?
I think institutions, I would say like schools should have personnel that can help actually listen to some patients or actually identify if there are issues going on in school. Some students have some of these things, but they don't know what it is. They just feel that way, and sometimes you would see someone that feel that way, they're like, that's all I've known. I don't know any other way. I feel like that was normal, but I'm suffering, but I just thought that that was normal. So it's good for, I'll say institutions to just have may either be therapist or counselor in-house, that can actually help, and also let the students be aware that, okay, if you feel a certain kind of way, here's where you could come, who you could speak to. And if there is, if they have to increase their level of care, they could kind of like, refer them out to someone that can actually fully help them. So I think that's something that therapists, uh, most institutions should have at least one therapist in place, for the
Yeah.
student.
Okay. And then what about maybe like the work side of things?
So the work side of things, it, so it can be tasking at times. There's one aspect of actually providing care, then documentation. Documentation is what takes the most time. So
Yeah, I completely understand that. Yeah.
yeah, so I would say documentation is the most tasking aspect of it. Yeah.
Okay. Yeah.
Yeah.
Oh yeah, and what do you do for yourself? Because I know that having to like listen to all these patients, obviously it's rewarding for you because you get to help them succeed. But for you, it can also be like taxing mentally because you have to hear all of like the pressures that other people are put through. So how do you deal with your own mental health?
Travel a lot. I travel a
You
lot. Yeah.
travel a lot? Oh yeah,
Yeah.
yeah.
So
Where have
that's
you
that's
traveled?
my everywhere, just anywhere. So that's
Yeah.
my self-care. Yeah. So, it's travel a lot.
What was your favorite place that you went to?
That's my favorite place. Nice, France.
Oh,
Yeah.
yeah.
Nice, France.
Nice
France.
place. I've never been to Europe though.
Yeah.
I really want to go.
My God, you like it.
Yeah. Yeah, I bet I will. I'm trying to go next year after college applications are done. That's the goal, just to go and travel with my friends. Yeah. So yeah. Um, and what are some common like misconceptions that you see related to these mental health issues?
Misconceptions. I would say that a lot of times, I don't know if I'll use the word misconception. Sometimes some people think that some feelings are normal. I know the word
Hmm.
normal is it can be controversial, but um, I would say, for example, depression, right?
Yeah.
Depression, sometimes one misconception about it is that, it's okay to feel like that, you know? Now, there's
Hmm.
one thing, it's okay to feel like that if something bad happens, it's something that can follow it. Now, the misconception there sometimes is now, if that lasts for a longer period of time, then that's not normal anymore.
Yeah.
You know, there's certain kind of feelings that follow something traumatic happens or something bad happens. Of course, you feel bad about it. But now, when if that lasts for months or weeks, we're like, okay, here is something that I need to seek help about. So I say that to say the misconception is like knowing when to seek help and not just assuming that that's okay.
Yeah.
It makes
Yeah.
sense. Yeah.
Yeah, I think for like a professional like you, it's easier, especially when you're kind of basing it off of like knowledge that you've gained, like maybe the DSM-5, like actual documentation. But yeah, I feel like for a regular patient, it is harder because they're not sure. Like, of course, just like how you said, how some students they'll be living their lives with a mental health condition, and they'll just think it's just normal the way they've been functioning, and so they don't actually go out for help. I think that's the same thing when someone maybe faces a traumatic scenario, they don't understand the severity of it, and so they don't actually go out to reach help when they actually should. So yeah,
Absolutely.
that completely makes sense to me.
Absolutely.
What would you say are some resources or support systems that you recommend to teenagers? So this doesn't have to be just or it doesn't have to be, first of all, it doesn't have to be teenagers, it could be adults as well, but it doesn't have to be just individuals who are facing specific issues like depression, but just like anyone struggling with mental health. Because I know that I get like some anxiety here and there sometimes for certain things. So what would you say are some resources or support systems that we can use?
So, our support systems are, I mean, there's therapists where, psychiatry as a whole, therapists that do talk therapy where you can just, speak to them and they kind of like provide a lot of, coping skills and just help navigate through some of the symptoms sometimes that can escalate to them actually requiring medication. Then we have psychiatrists, we have nurse practitioners, psychiatric nurse practitioners, you know, um, we have counselors. I know a lot of them in schools. So, here are some, I would say, resources that are there, in terms of like, providers providing care, and there are other online resources as well, that I think there's a NAMI, other online resources as well that helps. Yeah.
Yeah. Okay. Yeah. Thank you. So I guess this is the final kind of questions group that we're going to talk about, and this is just personal insights. So you already answered one of them. How do you manage your own mental health? But another one would just be what do you wish more people understood about mental health care and like the job that you do?
It can be tasking, but sometimes the improvement is not, sometimes it's not this quick.
Yeah.
Sometimes it can take time. So here's one, I would say that's one thing I would say.
Hmm.
Yeah.
What just I'm just curious, what is like oh it says running out of time. Sorry. I'm just curious, what is like the longest time that you had to like do a certain treatment on someone before they actually felt better? Or
Yeah.
were there cases where you just couldn't help the patient?
I try my best. I try my best
Yeah,
to my
of
best.
course, of course.
Definitely. Hmm. There are certain situations where you just have to refer out, you know.
Hmm.
There's certain situations you have to refer out. Personally, I haven't necessarily, most times my referrals are to talk therapy because I don't think medication only is all of it. You still need actual coping skills to help you navigate through your day-to-day activities. So a lot of times I do refer to psychotherapy, like
Yeah.
actual like weekly therapy or bi-weekly therapy, depending on how, but I mean the therapist kind of like decides on how frequent they want to see the patient. So yeah, I do if I feel like they need it, I do refer out for therapy. Yeah.
Hmm. And do you like kind of work alongside the therapist and at
We'll
like
communicate. Yeah, we'll communicate to see the patient's progress. Yeah, absolutely. It's actually very, very necessary to communicate with the other providers that are seeing the patient so everyone is in sync to what's going on.
yeah.
Yeah.
Okay, cool. I just want to end off with kind of a general question for anyone. Anyone can use. So, what are some like simple techniques that anyone can use day to day to just maintain good mental health?
Sleep,
Okay.
sleep. Um, Also trying to reduce or eliminate sugar and processed
Mm, yeah.
because we talk about, neurotransmitters in the brain, serotonin, 90% of it is produced in the gut, right? And the gut has a
Hmm.
connection to the brain. And a lot of times that's why sometimes when you eat things that are not so good, you feel it. You feel it.
Yeah.
So I would say definitely reducing sugar. It does cause a lot of inflammation in the gut. And probiotics are good. And reduce processed foods. So I
Okay.
would just two things and just have self-care sleep well, and just relax. I
Hmm.
would say, and have a therapist to talk.
Okay. Yeah, that's true. So far, my friends are my best therapists, but yeah, that's all good information. Yeah, I will definitely implement that. For me, sleep is a very tough one, especially if when the school year starts, but hopefully I can get some good sleep this year. So yeah, those were all the questions for today's podcast. So for anyone in the audience, the viewers who lives in Rockaway, New Jersey, or anywhere near Rockaway, Jersey, and is 12 and older and is interested in potentially working with Dr. Okechukwu for any mental health concerns or is just curious to learn more about him, go check out his clinic's website at www.mypsychprovider.com, and I'll put the link in the description of this video. And thank you so much, Dr. Okechukwu, for offering to come here and share expertise with me. And thank you, everyone else, for tuning in. Make sure you follow because I will be interviewing more specialists within the field of mental health, and I'll see you all very soon. Bye.
My pleasure. Take care.